All right, so let's understand why we no longer look like ourselves as we age. And it really comes down to this little Venn diagram. On one hand, you've got shape. Things that are happening during shape is things are starting to loosen, get longer, your face gets more square, jowls, neck laxity, eyelid laxity, all that stuff. On the other side of the Venn diagram, you've got changes happening to your skin. It's getting more fine lines and wrinkles, dullness, discoloration, dryness, etc., etc. So there's skin aging. You put the two things together and you have an aged-looking face. All right, so now let's look at how we're going to address and treat these aging changes. So on one hand, the shape is treated with a vertically oriented facelift. In my practice, that's called the vertical restore. So that gets the shape right back into that youthful heart shape that we all recognize in ourselves as we look in the mirror, we hope to recognize. On the other hand, you've got changes that are happening to the skin, and those are going to be best treated, truly most effectively treated with what you do on a daily basis. The use of retinols, vitamin C, niacinamide, peptides, hyaluronic acid, and all the things that decrease pigmentation, etc. All that together, at least in my practice, is used with the KaramMD Trifecta. That's how you treat skin. Daily use of actives. Combine that with the changes that address the shape of the face, and you've got yourself looking as young as you feel. That's how you address, in a comprehensive way, the facial aging changes. All right, so let's summarize it and make it super simple. You treat the shape with a vertical restore. You treat the skin with the KaramMD Trifecta. You put the two things together and you have a naturally younger looking face. Because why? What does a 20 or 30-year-old look like? They have young looking skin and a young looking facial shape. That's why this concept makes so much sense, and why the results look so beautiful and natural. Did that